can be a really stressful time for folks. We've never dealt with something like this in our lifetimes. Most of you have never experienced anything like this. I know I have not. And so wanted to touch on three main areas that people are dealing with right now. And that's the emotional, the physical, and the financial. We're pretty complex human beings. And these are three areas that are very important to us. But we want to be able to talk about some ways to cope with what's going on, and also have some question and answers as well to try to bring some peace and hope to folks. There's not a lot of peace and hope that is available in the media these days. There's a lot of bad news, a lot of discouragement. And so we wanted to bring some encouragement and some help and some hope tonight. So hopefully that's something that we'll all be able to enjoy. My name is Jeff Houston, and I'll be the MC tonight. And we're going to enjoy some speakers. And we've also got some questions that we would like you to ask. And there's a couple ways to do that. And Elon's going to pull up the information on submitting your questions. Two ways to submit questions tonight. One is with the website there, or you can also post those questions on the chat box. And there's an incentive to ask questions tonight. And so there will be a winner drawn, and the winner is going to get some Mother Bear's pizza, which since we don't get a chance to eat out as much as we have in the past, that's kind of at a premium. So you might want to go ahead and fill out some questions that you can ask. And if you want to address those to specific panelists, we're going to have one addressed to Chris on the health side of things, the physical side of things, and then on the emotional side, you can address those to Joel, and then on the financial side, you can address those to myself, Jeff. And so go ahead and start posting those questions either on the chat box or through the website address there. And we're going to go ahead and get into our panelist discussion tonight, and I'd like to introduce you to our panelists in a little more detail. And so I'm going to have some bios that are going to come up on the screen here. And a little bit about myself. I'm originally from Marion, Indiana, and I came down to IU in 1987, before many of you were born or were even a glimmer in your parents' eyes. And been a member of Sherwood Oaks Christian Church for a long time, active with that with my family, my wife Christy. We've got 5 kids, and fortunately they're all in town right now, so I can kind of keep an eye on them. 3 boys and 2 girls. And I am a financial representative at Bill C. Brown Associates, and I help people with their money. I like to think that I help make people's financial dreams come true. So that is what I'm going to be talking about tonight later on. But let's also take a look at our other panelists. And the other one is Joel, and he's professor, as you can see, of counseling and psychology in the School of Education. And he spent some time in Austin, down there at the University of Texas, where he got his PhD, and originally from Singapore, which earlier we got to enjoy as his background was the Singaporean skyline. Maybe he'll switch back to that here in a moment. But you can see what his interests are. And he's also developed some group programs. And so we'll look forward to hearing from him on our emotional well-being. And then also we've got Chris Sherwood. And Chris has been an RN for, as you can see, 29 years, working with women and children's health. And she grew up in Nigeria, as you can see. And so she's been all around the world. And she's back in Indiana, been here for 33 years. And she's married to Les. They have 2 adult daughters. And so looking forward, a lot of people are looking for some health answers right now, how to stay healthy and how to avoid the virus. So I think Chris is going to help us out with that as well. So we're going to start off tonight with Joel, and at the end there will be a time for questions, and so we'll just go ahead and let Joel talk, and then we'll have Chris come up next, and then I'll finish up, and then we'll have our question and answer time at the end. So Joel, you're on.
All right. Well, thanks, Jeff, and I just want to make sure in terms of time, Um, would that, how long I should go for about, I guess, 15 minutes?
You got it.
So probably around 8, 20 or 22, I'll start. Okay, well, I don't have any PowerPoint slides, so I'm just going to talk, and occasionally I might do a screen share to show to share some of my materials with you. But I just want to say hi to everybody here, and to say how glad I am that we can connect in this way. I'm going to just talk a little bit about emotional well-being and how to stay emotionally and mentally healthy during this stressful time. So one of the things that I think is just helpful for us to think about before I even start is to just do a kind of a check on yourself and see, how do you know if you're perhaps adjusting well emotionally and mentally. And a couple of signs that you can kind of pay attention to. Number one, if you notice that you've been having trouble concentrating, that's something that might indicate that your stress level is a little bit high. The second thing to pay attention to is your sleep patterns. If you notice that you've been sleeping a lot more than you typically do and you have trouble waking up, or you're sleeping way longer than you usually do, or if you have trouble sleeping at night, you go to bed, you really can't sleep. Again, that's something to be paying attention to. Number three, if you notice there have been drastic changes to your eating patterns, you're eating way more than you used to eat, or you have no appetite and you can't eat at all, that's again something to pay attention to. And number four, if you have trouble getting things done, like typically you're able to study and now you can't study, that's again something to be concerned about. If you have all of these together, trouble concentrating, difficulty sleeping, difficulty getting things done, changes in your eating patterns, it could be a sign that your stress level is a little bit more elevated than usual. And that's something that you definitely want to pay attention to, and to make sure that you're taking care of yourself emotionally. So look out for these signs that might be potentially warning signs of kind of high levels of stress in your life. But even if none of these are affecting you, you're not having trouble sleeping, you're doing fine, you can concentrate, I think it's still helpful for all of us to be engaged in simple practices or habits just to keep ourselves mentally healthy. Think of it as a preventative measure. Think of it as vitamins that you take to just keep yourself healthy, mental health vitamins to just keep yourself healthy. And today I want to offer you 5 tips, 5 practical things that all of us can do. They're very easy to cope with the coronavirus strategies. And I'm going to zoom in on the 5th one in particular. The 5 things involve 3 things to do and 2 things not to do, right? So 3 do's and 2 don'ts, okay? You ready for that? But before I get into the 3 do's and 2 don'ts, I just want you to know that if you have any questions for me, you can either reserve your questions to right at the end of our webinar, or you can actually type in questions in the Zoom chat and post me a question immediately, and I'll be happy to answer those questions in real time. So whichever works for you, I just want you to know either option is fine. So don't hesitate to send me your questions along the way as I talk. Okay. With that, 5 tips for how to stay emotionally and mentally healthy during this time of crisis. And these are 5 things that I personally try to do, of which I have been fairly successful with 4 out of the 5 of them. I will admit to being less successful with the 5th, but I'll share it with you anyway. All right, number one. Number one is something that will help you physically too, but it's actually very healthy emotionally and mentally too. And that's, I try to take walks every single day outside of my home. Now, some of you have heard about the governor's executive order, if you live in Indiana, that all of us are supposed to stay at home until April 6th, and we're not supposed to leave the home except for essential matters and emergencies. But if you look at the governor's executive order very carefully, it actually includes an exception for taking walks. And that's something I really encourage us to do, because in our daily lives, if we weren't in this crisis, if we weren't involved in all these restrictions, many of us will be walking around way more than we typically do. And even if we don't realize it, walking around is one of the most helpful habits we can maintain to stay mentally healthy. A lot of our thinking, a lot of our processing takes place when we walk. If you ever feel stuck, you're studying and you feel like you're caught in a rut, you can't figure things out, take a walk, take a walk. So one thing I try to do every single day is I take a walk. I take, sometimes I do it just before lunch. Sometimes I do it after lunch. Sometimes I do it in the evening, but I just take a walk, 20 minutes, and I just walk around the neighborhood. And I don't even try to run. I mean, sometimes I run, but it's totally fine just to walk. But it's one of the ways to clear your head and just allow yourself to relax, right? Now, as I take walks, I also try to maintain a physical distance from others. So sometimes when I see someone else farther away, I would say hi to the person, but I'll keep my social distancing. By the way, I prefer to use the word physical distancing rather than social distancing. So I keep my physical distance, I say hi, but I take my walks. So number one, take walks around the neighborhood that's physically and also mentally healthy, right? So my goal is to aim for about 5,000 steps in a day. If you have a Fitbit or an activity tracker, that's one of the things you can do. Number two, I try to keep social connections with other people. So we're supposed to practice physical distancing, but let's not forget social connections. So I don't do social distancing. I practice physical distancing. I keep away from people, but I try to connect socially with other people. And one of the ways I try to do that is through video chats, Zoom. So if I have, to connect with a colleague, to discuss some things, I often say, hey, why don't we do it over Zoom? And let's talk. Because in our daily lives, we often talk to people face to face. And now that we don't have that opportunity to do that, let's find excuses. Let's go out of the way to see each other face to face. Now, many of us are very good with text messaging and emails and Facebook and Instagram and all kinds of other things, right? All that's great. But there's something really beautiful about connecting face to face that helps you stay mentally healthy. A lot of research showing that face to face connections are really good forms of social connections. So I do that in work. I sometimes do that with friends too. I just connected with friends. I had a friend reach out to me over email and said, hey, how are you doing? Haven't talked to you for a long time. Are you doing okay? And I replied to say, I'm doing fine. And say, by the way, do you want to just talk over Zoom? And that's what we did. We just chatted over Zoom for about half an hour. I had a group of us, friends. There were 9 or 10 of us. And we did a Zoom chat, and we chatted for 2 hours, just connecting, no agenda, just chatting, right? So number one, take walks around your neighborhood. Number two, find an excuse to connect with each other through video chats. Number three, all right, this is something I try not to do. If one of the best ways to get yourself really anxious and to be really nervous and to worry a lot is to be reading news about a coronavirus all the time, especially from less reputable sources. So one thing I stay away from emails. I stay away from emails that talk about a coronavirus. I stay away from social media. I stay away from blogs and text messages and people telling me about a coronavirus. Lots of rumors, lots of misinformation. I don't need that stuff. I only try to get my source from credible networks and newspapers. All right. Number four, I try to read the news no more than once a day. Okay, I've been less successful with this goal, but that's one of the things I'm trying to do. Don't Don't spend all your time reading the news about the coronavirus. It's just going to get you anxious. And one of the things I've discovered is that if I read the news about the coronavirus just before I go to bed, that's probably the worst possible thing I can do because I get really anxious and have trouble sleeping. So basically, don't read the news more than once a day and don't do it before bed. The last thing I want to share, and this is the one thing that I find to be really effective, really helpful, is I maintain a daily gratitude journal. So every single day, I write down 3 things I'm grateful for, and I provide a reason why I'm grateful, for each of these 3 things. And that, I want to share with you, friends, is one of the best things I've ever done in my entire life. I started that before the coronavirus situation exploded, but I've kept it going. And it's just a 5-minute investment. And if you haven't tried it before, I want to encourage y'all to do it. Now, some of you might be thinking to yourselves, well, is it good enough just to have grateful thoughts in your head, right? I think grateful thoughts. Yes, having grateful thoughts is great, but I want to encourage you not just to think grateful thoughts, but to actually write it down. Why? 2 reasons. When you write down a grateful thoughts, you actually deepen the thought and you become even more grateful. You actually elaborating on what you're thinking on. Number 2, you get to keep a record of what you're grateful for. And this is something that you can keep forever and go back and refer to it. All right? Now, some of you might be wondering, how do I stay grateful when there's so much stress going on, when there's so much bad news? And the trick is to keep it really, really simple and really easy. I don't try to write down very difficult and profound ideas for which I'm grateful for. I write down simple things. In fact, the simpler, the better. So what I'm going to do right now, and I hope this is going to work, is I'm going to do a screen share with you to show you how easy it is to do a gratitude journal. I'm actually going to show you an example from my own gratitude journal. All right, can you see, can all of you see this? Is this showing up on the screen? Yes. Yep, right?
Yep, got it.
Okay, right. Okay, this is my journal entry from today. So I wrote down, my goal is to write down 3 things I'm grateful for and why. I wrote down 4 today. This is April 2nd. Number 1, I'm grateful I took a walk with Caitlin, that's my daughter. And as we walked, we talked about her future and her career. Number 2, I'm grateful for the weather because it was sunny but not too hot. Number 3, I'm grateful for a cookie cake I ate this morning because Caitlin baked this cookie cake. And number 4, I played bridge with my family yesterday. If you haven't heard of bridge, it's a game that older adults play, but I play it and it's lots of fun. And so you notice they're all really simple things, nothing very profound, right? But this is one of the best practices I've maintained. I strongly encourage you to try it if you've never done it before. There's so many ways you can do it to start a gratitude journal. For those of you who are low tech, you don't like all these profound stuff, you can just buy a gratitude journal and physical copy and write it by pen, using a pen. If you don't like that, you can also use an online blog like mine. I maintain an online blog. My blog is private, which means nobody can access it, so you will never find it online. I just keep it for myself. You can even use a Google Docs document and just write what you're grateful for. Or number 3, you can use a gratitude app. If you go to an Apple store or if you use an Android device, you go to Google Play, you can find lots of different free gratitude apps. And there's actually a gratitude app that my colleagues and I have created. If you go to Apple Store, you type in Gratitude Journal IU, you would find a gratitude app that was developed. It's really simple, it's no frills, and just allows you to enter things that you're grateful for. I just want to warn you, if you use that app, it's possible that I may have access and I may be able to read what you write. But if that doesn't bother you, try it, all right? So my time is up. I've shared with you 5 practices for staying mentally healthy. And I've said I strongly encourage you to try a gratitude journal if you've never done that before.
That is great, Joel. And I like what you said. You said older people play bridge, but I do too. So that's
Great.
how you stay young and energetic. I like that. All right, let's go ahead and let's have Chris. Let's have you share.
Thank you, everybody, for letting me have this time to share with you. And I'm going to pull up I did do a PowerPoint. Okay, so today I wanted to talk to you about how can I remain physically healthy during the corona epidemic. And I put this first picture up here. It says healthy body and healthy mind equals a happy person, because really a lot of what Joel said is going to also affect what I say, because your mind and your body go together, and you need both to be healthy. So first of all, I really believe it's important to get good information. Whenever you want to be healthy, you need to look at the sources that you're going to. So first of all, I want to tell you that everything that I'm going to talk about today is pretty much come from the CDC website, and that's the Centers for Disease Control. And I recommend that you also look at World Health Organization, the Mayo Clinic, WebMD, and I really like Dr. Fauci. I think we've seen a lot of him recently, and I think he really knows his stuff, and he seems to be politically unbiased. So those are some things that I want you to think about, but I also really want to highly recommend that you stay away from Facebook and news sites and in general politicians, because most of them have, they're telling you different information for their own benefit. And so whenever you think about getting information about your health, make sure you look at who you're getting it from. So I know you've heard a lot about coronavirus and the symptoms and what it means. So I don't really want to reiterate that a lot, but I want to, will I know if I have coronavirus? Well, you may not know. Some of us are going to have very mild symptoms. And right now there are probably a lot in our community that are walking around with mild symptoms and they don't know they have it. I know here, because I work in community health, I don't work directly with patients, but my supervisor is over public health, and she's been very involved with the testing and et cetera. And she said that there have been several people that have been tested that are healthcare workers that just had a little bit of a sniffle or something that's not that much, and it came back positive. So that's one thing to consider that we may not know. And that's what makes this illness so different than a lot of things. 80% of people that do get coronavirus will not need health care or have to go to the hospital, and they can stay at home. And so it's a very wide variety, as you've heard on TV and in newspapers and et cetera online, that it's a wide variety of symptoms. I went ahead, like I said, I don't want to reiterate things that you probably already know, but usually they appear between 2 and 14 days after being exposed to somebody. And it seems like the median age time is about 5 days. Most people are going to have a fever, and most people are going to have a cough, and they'll start feeling the shortness of breath. But as I said before, it could be just very mild, and you may just have a sniffle, or you just don't feel right. So if you do develop trouble breathing, persistent pain or pressure in the chest, any kind of confusion, or you notice a different color, that's when you do need to definitely contact your physician. And you can call directly to your physician, but right now IU Health has an app that I really do recommend putting on your phone, because you can get a free virtual visit with them, and they'll do a screening. And I did send that information about how to get that app to Elon, and he will be putting that up with our handouts. So I really do recommend that you do use that. I've had several of my patients call that line, and they do a very quick, like a FaceTime type screening with you, and help you decide whether you need to go to the hospital, whether you need to call your doctor, or if it's okay for you just to watch yourself. So how can I prevent or prepare for the coronavirus at home? Basically, if you are an older adult with chronic illness, I really would recommend staying home and not going out. I would, if somebody else could get your groceries for you, I would do that. I still would go outside and walk and do that and socialize, through social media. But if you don't have to go out of the house, if you're immunocompromised, don't go. It would probably be a good idea to figure out, if you do have somebody in your home that gets sick, which room in the house would be the room that you would isolate yourself to, so that you can try to prevent the risk of spreading it to other members in your house. Wash your hands frequently. Avoid touching your eyes, nose, and mouth, and just stay home when you're sick. If you're sick and not feeling well, don't go to the store. Like I said, it's still okay to go outside and be on your porch or walk where you're not around anybody else, but stay home. Cover your mouth, and make sure you throw that tissue away. And so any of those droplets that you could spread, you need to just take care of it yourself and don't let anybody else touch that. Clean and disinfect frequently touched objects and surfaces. So I know on the media, we've been hearing a lot of things about going to the store, and when you get home, make sure that you clean your cans and other things that you got at the store, or you're leaving your mail in the garage for a few days, or cleaning off boxes that Amazon drops off at your place. So I think that's something to consider. Whenever I looked up how long does coronavirus live on surfaces, I got all kinds of information, and nothing really was consistent. Looking even on reputable sources like World Health Organization or CDC, basically what I read was it could be from anywhere from 2 hours until 5 days. For example, they thought that on cardboard it was about 24 hours. So that's something to consider. Everybody, I think that's a really personal decision, how you want to handle it, but you may want to consider, when you get something from Amazon or delivery, to use some gloves to unbox it. I've read where everything that's in the box should probably be fine, but you might keep some wipes to clean things and before you bring them in the house. What kind of cleaning agents should you use to kill the coronavirus? Well, there are two things that we know that's really good that cleans, just practical things, and they're not expensive. Is, you can see in my slide, there's just just simple bottle of 70% rubbing alcohol. And that is something that you can wipe surfaces down, and it should kill coronavirus. The other thing is bleach. I could not find how much to dilute the bleach, quite honestly, but I would put some bleach in water, but just be careful, that will also bleach anything you put it on. But bleach will also clean. And a lot of other just regular household disinfectants that have bleach or alcohol in it will take care of killing coronavirus. The other thing that is pretty controversial, and especially this week, is should I wear a mask when I go out of my house? And this week I've seen a lot more people out and about wearing masks, just in general public. And the CDC has recommended that you really don't need a mask unless you are taking care of patients, but they are starting to look at things. So first I want to start with what we do know. So if you're caring it for somebody that is immunocompromised, that'd be somebody that has cancer or some other, or I would consider even diabetes being something that somebody has that's immunocompromised, or some chronic condition, then I would say, yes, I would wear a mask around them or have them wear a mask. if you are sick, then you need to wear a mask because you do not want to spread those droplets to anybody else. And of course, if you are somebody that's immunocompromised, I would wear a mask. But why is the CDC reconsidering their stand on all people wearing face masks? Well, they're looking at that face masks may actually be the most effective way at slowing the spread of COVID-19. And if they're widely used, it may be a way of preventing people that don't know that they're sick from spreading it to other people. I think the reason that they have really held back in not making it something that they would encourage everybody is that in general, the healthcare system right now has a lack of enough PPEs or personal protective things for healthcare workers to use, and really they need to have it. So I think that they really are trying to get people to do social distancing instead of wearing face masks as much as possible. You may also see a lot of people are making their own face mask or using a bandana. And that's something that if you feel that that's something that you want to do, I would highly recommend doing that instead of using a face mask or something medical that should be used for somebody that's working with direct contact with sick patients. Another thing that I've heard is soap and water better than hand sanitizer, or should I be using hand sanitizer? And everything that I have read shows that a good old-fashioned 20-second hand scrub with regular soap and water is actually the best. There's the chemical qualities of soap will bind with germs and break down the membranes of the germs. And the friction of just scrubbing your hands will be the most effective in killing the bacteria. And so that is the number one thing. But having hand sanitizer is really convenient. And quite honestly, I keep it in my car. I use it a lot when I go in and out of seeing clients because I work in homes. And it is very effective in cleaning off the germs in those situations. But one thing to note is that to be effective towards COVID-19, hand sanitizer needs to be at least 70% alcohol. And a lot of these hand sanitizers, especially the ones that smell really good, are really not 70%. I think most of them are around 40%. So to be effective in using hand sanitizer, make sure that you have just the plain old non-smelling 70% alcohol hand sanitizer. I know right now that's even hard to find. So a lot of things we have control over, like we can do social distancing, wash our hands, and etc. But there's other things that we do have control over and that keep us healthy. And Dr. Joel did talk about a lot of these already, and he did talk about this one. It's about getting out and exercising and getting fresh air. That's something you can do, and I would highly recommend doing that every day. Not only does that keep you mentally healthy, but it keeps you physically healthy. Eat a healthy diet. To be honest, it's hard not to just want to eat a bunch of junk all day long because you're home, you're a little anxious, etc. But in the long run, that's really not going to be helpful to keeping your body healthy. So it's okay if you have a day or two where you have a bad day and you just eat what you want. But in general, really try to be conscious. Some of my friends have said that they put aside what snacks they're allowing themselves for that day. And I've seen people doing that for their kids. They just put a bin that says, this is my food or this is my snack for the day. And if once they eat it all, then they can't have any more. And so that's something to think about, just another practical way of eating healthy. Another thing is get plenty of sleep. I do want to say, though, that I know that Dr. Joel was talking about one warning sign of depression is sleeping too much or not sleeping enough. So make sure that you get a reasonable routine amount of sleep. But if you start seeing that you're sleeping too much or not sleeping at all, then I would seek some behavioral health counseling or support. Also, take your regular medications. This one is for me, that I wrote that down because I'm an asthmatic and I get really bad about not taking my asthma medicines. But I've been trying to be better about that because I want to keep my lungs as healthy as possible. So if you do have routine medicines that you're supposed to take, please go ahead and take those. And this is the question I get a lot. I just want to touch briefly. And we do have 2 hospitals in our area. One is Monroe Hospital, and I have to be honest, I don't know a lot about them. I do know that they have COVID patients they're taking care of right now. I have worked for IU Health System for 29 years, and I have been privileged recently to not be in leadership, but still be around a lot of my coworkers that are in leadership. And I will say that I have been really impressed with the planning that I'm hearing is being done. There have been a lot of, every day for the last 3 weeks, they meet 3 times a day in a command center and talk about what's happening right now, how we can prevent things, and taking what has happened in other places, and they've just made a lot of progress and plans. I don't work in the hospital, but as of yesterday, I already have my assignment that if things get bad, I know what I will be doing, and I will be going to the hospital and be helping out. And so I just want you to know that we don't know what we don't know, but I do feel that the hospital and the leaders in the hospital have done a great effort in trying to be prepared as best as they can. And at this moment, we do have a nice amount of supplies, including protective gear that you hear about on TV that we don't have, but we had a pretty good stockpile. So I just want to give that assurance, and that I feel that the best that we can do, we're trying to do right now. That's all I had right now, and I'm going to pass it on to Jeff.
Okay, thank you, Chris. And I just want to confirm, I saw a sign today and it said that stressed backwards spells desserts. And I don't know if you can comment on whether that's a good thing or a bad thing.
I saw that same sign here in LA. And the thing is, it was at an ice cream place, and I thought, when I drove by, I thought, that sounds really good.
Oh, maybe they had something they were selling.
Yes. So I would say that, yes, people do stress eat, and they tend to eat things that are not the most healthy, and dessert would be not the best thing. I think it's okay to have a little bit of that, but that's one of those things I would limit, and because that in the long run will not be the healthiest when we do get out and see each other. I do see that, are there a question about any alternatives to hand sanitizers if they're unavailable in the store? I will tell you that Cardinal Spirits, they have been making, they do make alcohol and other types of liquor, but they have been making hand sanitizer by the gallon with their vodka recently, and they have been giving it to Bloomington Hospital. They've given us a gallon of it, and anybody can walk in there and bring their own bottle and request some of that, and that is, they are making it according to the World Health Organization recipe. And so somebody was asking an alternative. So that is something, there is a recipe on the World Health Organization website, but if you want to get it locally for free, Cardinal Spirits does give it out if you take your own little container.
And again, that's for your hands. It's not for consumption. So let's keep
exactly. This is for your hands.
All right. Good deal. Thank you, Chris. Okay, I'm going to talk about mostly what I thought financially might be affecting students right now. There's been a lot of changes in the last 2 weeks overall in the financial world. And so I'm going to try to touch on things that have the most impact on students right now. I'm going to start out and talk about housing, because there have been some real major changes that have happened. And in the state of Indiana, for example, the governor has signed a memorandum that basically says that you cannot get evicted from your apartment in Indiana for non-pay until further notice. And so this is part of the government's efforts to soften the blow financially for folks who are suffering because of either lost jobs or loss of income, decreased income, or other financial straits that they might find themselves in. Secondly, if you can't pay your mortgage, or you can only pay a portion of your mortgage, you may be able to get some assistance there as well. Contact your mortgage servicer immediately. Tell them what's going on. Tell them what you're dealing with. And they should be able to work something out for you. And so there's some real protections in place right now that'll protect you on the housing side of things, that you shouldn't lose your housing due to financial reasons, because there's so many things in place right now to help you. And so that's one stress that that you should be able to put on the back burner, because the government has stepped in and said that they're going to help out as much as they possibly can. Another area that they're helping out with, and most of this comes from the CARES Act, which was passed by Congress last week, and it's over $2 trillion. That's T with a trillion, which is more zeros. It's actually 18 zeros if you happen to count them. It's just a lot of zeros. It's a tremendous amount of money that has been basically guaranteed by the government to help people out in paying their bills and dealing with all their finances. And so in the area of college student loans, the law has suspended monthly payments through September 30th with no penalty. And so interest is going to be suspended. Balances will be frozen. The account will remain in good standing. And all this information, by the way, is going to be available to you. You can download it from the chat, the group chat page. And Elon's going to make these documents available to you. And I've got this on just a PDF document that has this information as well. But basically, it covers student loans that are made directly by the federal government, and a portion of those that are made by private lenders and guaranteed by the government. And so again, with your college loans, if you are in a position where you feel like, gosh, I've lost my job and I'm not getting a paycheck, I'm not going to be able to pay those. Well, good news. They've suspended those monthly payments with no penalty. There's also an incentive if you're employed. There's an incentive for your employer to pay down part of your student loan balance. Employers are able to contribute up to $5,250 toward each worker's student debt through December 31st of this year, with no tax consequences to you. So that basically, if you were able to talk your employer into doing this, and employers don't have to do this, this is something they could choose to do. But if you were able to talk your employer into paying towards your student debt, that's like getting a tax-free raise. So they're basically paying down some of your debt, and you're not going to be taxed for it. And so that's a nice feature that is an incentive to employers to help pay down their employees' student debt and provide some nice tax benefits, and they have an incentive as well. Okay? So that's on the college student loan side of things. We've got help in the housing area, we've got help in the student loan area. There's also going to be some stimulus payment checks that'll be coming out in the next couple weeks. And don't get too excited. If you're a student and your parents are still claiming you on their taxes, then I'm sorry to say you won't be getting a check, okay? If you don't have a Social Security number, probably not going to get a check either. And so if you haven't filed any taxes in 2018 or 2019, I would not expect a check either. But I will talk a little bit about who should expect a check and what those checks might look like. So it's kind of a sliding scale. And if you're single and you have filed taxes in the last couple of years, and your adjusted gross income is $75,000 or less, then you should expect a check from the U.S. government of $1,200. If you're married filing jointly and you make either $150,000 or less, you're both going to get a check for $1,200. If you have children in the house and they're under the age of 17 at the end of the tax year, each one of those kiddos is worth $500 each. So you should have more kids. If you're filing head of household and you're making $112,500 or less, you should expect a check for $1,200. Okay? So there's also a sliding scale. If you make a little bit more than that, all the way up to, say, for single people, if you make like $80,000, then you're going to get less than $1,200. If you make $99,000, you're going to make hardly anything as a single filer. And so it does move up on that scale, and you can look at the information that I've provided or Google that information as well. But you must be a resident alien. You can't be claimed as a dependent for somebody else. And it would be really helpful if you have filed taxes in 2018 or 2019. They just flip-flopped on that piece of it in the last 24 hours. And so even if you didn't file in 2019, you still might be able to get a stimulus check. So those should arrive, they say, sometime in the next 3 weeks, okay? And so that'll be really nice to get that check. You can spend it on anything you want. There's no restriction on what you can spend it on, and it is available to you, all right? I've had a lot of calls in the last week, 2 weeks from my clients talking about the stock market. So I'm going to talk about stock market volatility right now. And just as a little history lesson, I was talking about this earlier, but 11 years ago, there was a financial crisis, 2008, 2009. It was brought about by the mortgage bubble and the housing bubble and the stock market bubble all at the same time. And so the Dow Jones Industrial Average in the middle of that crisis, at the very bottom of that crisis, was at 6,500. And the Dow Jones Industrial Average is really a measure of the stock market. It's really just 30 stocks. And there's a formula that goes into that, but it's tracking the value of 30 stocks. And so it was at 6,500. And earlier in February, it had gotten up to 29,500. So in those 11 years, it had gained 23,000 points. So it was the most unprecedented bull market return in all of history. And there were tremendous gains. In the last 2 weeks, it's lost about 7,000 points. It's been hovering right around 22,000 here in the last few days. And so that kind of volatility, when you drop 7,000 points, and then say last week it gained 4,000 points, Monday through Thursday, and then Friday it was down 1,000 points, and so it's jumping all over the place. People are asking, what should we do? And it depends on how old you are. It depends on how your portfolio is made up. It depends on your risk tolerance. There's a lot of things that go into that. But for people that are younger, this actually is not such a bad thing. If you're buying, you're putting money into your 403B plan or your 401k plan, or you're investing right now and you're young, you're buying stocks at prices that you couldn't get 3 weeks ago. They're 25, 30%, or 40 or 50% off. When I go into the store and I see a bargain bin that has things on sale for 25, 35, 40% off, I like that kind of a sale. And so personally, I've been buying the last couple of weeks because I like to buy things at a discount. When I go by the gas station, I see gas for $1.69. It makes me want to pull in there and fill up my gas tank. And so this is a buying opportunity if you're investing for the long haul. If you're already in retirement and your whole portfolio is in the stock market, that's not such a good thing. That's why diversification is one of the ways that we help people to spread the risk around between different investment classes, some conservative, some moderate, some aggressive. And the closer you get to retirement, the less you should be relying on the stock market for the returns in your portfolio. You should have more conservative investments so that these types of situations don't arise that force you back into the workforce. And so if you're younger, this is a great buying opportunity. If you're in your middle ages, this might be a time to take a look at your portfolio and maybe reallocate. For most people, waiting for the recovery is probably not such a bad idea, because we have recovered from 100% of every downturn we've ever faced in the stock market. The future success of the stock market is based on people buying goods and services. I don't think people are going to stop buying goods and services in the future. And I think Amazon.com is probably going to survive through this. I think Walmart's still going to be standing. People ask, but what if the stock loses all of its value? For that to happen, that would mean McDonald's is not worth anything. And I don't know if you've noticed, but the real estate that McDonald's owns happens to be on Main Street in the best locations in every city in the world. And so just the real estate alone that McDonald's owns is worth billions and billions and billions of dollars. If they never sell another cheeseburger again, they're still worth billions of dollars, because real estate's not going away. And Walmart has a lot of stores, and there's a lot of companies that have a lot of factories, and they have a lot of hard assets. They're worth something. So I wouldn't be too concerned about the stock market losing too much value, because there's a real value in some of the hard assets that they own. So I guess one of the things that I've been talking to people about is diversification is a good idea. Not making any big moves right now. Definitely talking to a professional advisor. Your neighbor who has hot stock tips, probably not, that's like, your neighbor should not be the one you're going to for your emotional health or your physical health. It's the same story that you've heard from Chris and from Joel, that you have to be careful about your sources, and the internet is not necessarily the best place to find information on the stock market, because your source is not always the most accurate and dependable. And so you do want to talk to somebody who's been through multiple markets like this and has been able to navigate for many, many people these types of downturns, and has some advice that's based on a background of helping people through these types of things. And so I had a lot of conversations about people about not panicking, not watching their portfolio every day, not looking at it every day, just like you don't want to watch the news every day. Sitting down with a professional, making sure that your allocations are best based on your time horizon, and how old you are, how long it is before you're going to retire, and your risk tolerance. How comfortable are you in your accounts going up and down with the volatility in the marketplace? Those are some of the things that we talk about. And just to make sure that the investments that you're invested in are quality investments that have lower expenses than average, and that are designed to be able to withstand some of these types of markets. And so it's a good time for a checkup, not just checking up on your emotional health or your physical health and monitoring it. It's a good time to check up on your financial health as well. And so the other things that we always talk about are, it's always good to have a nice, healthy emergency savings plan in place. A lot of folks have lost their incomes and didn't have an emergency savings in place, and therefore they're in a really tough situation right now. And so emergency savings are crucial. It's good to have insurance plans in place, like life insurance. And the time to get life insurance is when you're healthy, not when you're exhibiting some of the symptoms that Chris was talking about. Life insurance companies are not going to be real eager to give you coverage. So it's good to have disability coverage. If you do get sick, then somebody else is going to be paying your income. These are all types of things that you need to be looking into. If you don't have them now and you're healthy, now is a good time to be having these types of conversations. Someday when you're getting older and you need care that Medicare is not designed for, like long-term care, it'd be good to have long-term care coverage in place so that an insurance company can pay the bills if you need home health care or assisted living care or in a nursing home. And so these are the types of things that a financial advisor can help you out with. and get you covered both to play defense on the insurance side and offense on accumulating monies so that you can retire someday, so you can send your kids to college or help send them to college, and to be able to fund the things that you feel like the Lord is leading you to do. And so that's about all the time that I have on the financial piece. And I think we want to get into some questions here. And so why don't we start off with some of these questions that are in the chat. And this one's for Joel. Call it as the solitude of 2020 or COVID-19 led summer hibernation, the normal activity of all of us is curtailed to an extent, akin to being in a luxury home prison. In this situation, anyone is more likely to get addicted or soaked into social media or food or have sleep disturbances. I'd like to know strategies that one should follow social distancing from social media or food and to prevent sleep disturbances. Joel, can you speak to that?
Okay, let me just take a look at when, so the question was about how to stay away from social media. Did I
How do you
get that
deal with
right?
social media? Because that's what everybody wants to do right now. And how do you kind of protect yourself from some of the traps that can pull you into?
Yeah, couple of things I'll say, first of all, about the research on social media. There's actually some research on that suggests that people who spend more time on social media are actually less mentally healthy. And we often think of social media as a way to connect with people, but it creates a bunch of problems that I just want us to be mindful of. The first is that social media is often a means by which we make social comparisons with other people. So when you see pictures of other people on Instagram or Facebook, they're all happy and smiling and perhaps showing off their latest vacation destinations. I know that's not likely to happen now, but it basically makes you envious and unhappy. And number two, social media is often a source of information that would provoke a lot of anxiety and panic, some of which may or may not be accurate, because in social media, you have the license to be a little bit more dramatic, whereas in sort of more standard old school news sources, there's typically an editor who's vetting the information that's coming out. So even before the coronavirus emerged, social media has always been a source of anxiety for people, because you just get the latest rumors and the latest sensational information. So So what do you do about that? Well, I've got a couple of suggestions. First of all, by the way, this suggestion did not come from me. I read it in a book called Deep Work. If you are interested in it, Google this book, Deep Work. It's a book about how to concentrate and focus on your work without getting distractions. And the author of the book, Deep Work, issued this challenge and said, why don't you try abstaining from social media? And in his case, the author was recommending Facebook. Abstaining from social media for a month and see if you would miss anything and see if others would miss you. And often the excuse that people give for not doing is that, no, I can't do that because people are going to miss my presence. And the author of Deep Work said, try it for a month. And it's very humbling. A lot of people who tried it came to realize that nobody missed them. So not only do you not miss being there, people don't miss you at all. So to completely disengage for a month and to see how it goes. And if you're going to try that, chances are you may experience a little bit of what's called withdrawal symptoms. Because if you're so used to being able to check your regular source of information, you might start feeling a little antsy and anxious about what to do. And so, I always tell people that if you're trying to give up something, you should always develop a complementary positive habit to replace what you've just given up. If not, you're going to be you're going to be doubly anxious all the time. So if they're going to give up ice cream, you need to have something to replace the ice cream, right? It can't be nothing, right? So if you've spent all your life or checking on Instagram or text messages or whatever source you go to, for a lot of international students, you might go to WeChat or WhatsApp, you know, and you're disengaging from that, right? I would say develop an alternative positive habits. So it could be, hey, start a gratitude journal. Whenever you feel anxious, take a walk, right? Do some exercise, all right? Maybe do some journaling that doesn't have to be gratitude related. It could just be just write about your thoughts and feelings. All of these exercise, journaling, are all positive practices that can serve as a replacement for what? From abstentions from social media. So I find that with social media, the challenge for a lot of people is that it is hard to do it in half measures. It's sometimes some people can have the discipline to say, I'm just going to restrict myself to say half an hour each day, and I'll keep it there. And if you can do that, that's great for you. A lot of people, they can't control themselves. They just have to check. And so for a lot of people, if you know you can't control yourself, it might be better to go cold turkey, right? To go cold turkey means you completely abstain from it, delete and completely remove the app so that you have no opportunity to get on it. And try it for a week, try it for a month, and see how it goes.
That's really good, Joel. And I can say just personally, I was challenged by, it was a minister online that just said, you know, spend the time reading the Bible, and Psalms is where they were recommending it. So I started with the 91st Psalm. And so every morning I'm reading from Psalms. I can't tell you how much better my day starts off by starting out in Psalms, which are so encouraging, and they seem to speak to the history that we're living in right now. David, who wrote a lot of the Psalms, had a lot of tragedy and a lot of scary things that he was dealing with. And it's just very encouraging, very consoling, and that's been a game changer for me. So that's good stuff, Joel. Appreciate that.
Great.
Hey, Chris, here's another one for you, Chris. It says, I learned that the usage of antipyretics, especially NSAIDs such as aspirin, ibuprofen, etc., are known to aggravate the COVID-19 symptoms. If I happen to have low-grade fever with dry cough, with apparently no shortness of breath, should I abstain from antipyretics, even Tylenol, acetaminophen?
Acetaminophen.
Yeah,
So,
that's what I said.
NSAIDs versus Tylenol. So when we talk about that, there's been a lot of things on Facebook, and I've seen some talk on the media. And so I did my research on this recently because I prefer ibuprofen, which is the NSAID. And I had a big bottle of it, and I did not have Tylenol. And so, yes, I did go and buy me some Tylenol before I did my research. After doing research, looking on CDC and World Health Organization sites, they said that really is false, and that ibuprofen or acetaminophen, either one of them is fine from what I can tell.
Okay, that's good. This message has been brought to you tonight by ibuprofen, and so just run out and get yourself. That's good. Okay, I've got a question here. It says, is there a citizenship requirement for receiving the stimulus check? And looks like, according to the Coronavirus Aid, Relief, and Economic Securities Act, non-U.S. citizens with a Social Security number who live and work here, including green card holders and workers using visas such as H-1B, H-2A, are eligible to receive checks. Non-resident aliens who do not have green cards will not receive them. Okay, hope that answered that one. And we've got another one here. Someone has asked about, for Joel, says, as an Asian, I'm so scared to go out at this point. How can I appropriately respond to racism, and how can I deal with this fear?
Yeah, I just want to say that racism is a very valid concern. There has been a lot of very disturbing reports that I've heard and read about of racist acts committed against people of Asian descent in the US. And that's something we're going to have to be very vigilant about. Unfortunately, none of us can guarantee this will not happen. And so that's something that we need to be very careful about. And we want to balance that with the need to be able to carry on our lives. So for me, I've tried to be vigilant, but I've not let that affect my life, because the way I think about it is, if I give in to that fear and stay at home and not do things that I would normally do for fear of racist attacks, then in a way I'm letting the racists win, right? Because they have won simply by me being cowed by fear and staying at home and not being able to get around doing my things. So I'm not going to let them win. I'm going to continue my life as per normal. I'm going to go out. I'm going to do things. I'm going to continue with my life as per normal, but being more vigilant, just keeping a lookout for what's happening. And as you know, if you are subject to any racist attacks, this is, even if it's just verbal in nature, this is not simply a moral and ethical issue. It could potentially be a criminal issue too. And I would strongly encourage you to report that to the police. If this is happening within the context of IU, you should definitely report that to the university too, and so that an investigation can be conducted.
That's good, Joe. Appreciate that. And this one goes, I'll leave it up to either Chris or Joel on this one, or maybe both. Practical questions for friends right now. Are there any free counselors to help those that are needing it at this time, like those who are getting depressed?
I think so. I was going to recommend the Center for Human Growth, which is the training clinic offered by the counseling program at IU. The problem is that the clinic is currently closed during the time of the coronavirus crisis. So I think the only service I'm aware of is Catholic Charities. Do you want Chris, do you want to speak to that?
Yes, so Catholic Charities is a not-for-profit organization that's in Bloomington, and if you contact them, they are actually taking new clients right now, and you can do a virtual visit with them. They do a sliding scale. They bill or they can bill insurance if you have it. They have recently. I've helped some of my clients get situated with them, and they actually, so they have no income, and so they're seeing them for free because they have a grant that helps with certain situations. So that's an option. There's also Centerstone, and they're doing virtual visits too. Now, so Elin, I think, was going to put something up at the end of this program for students. And so that's something that, right, Elin, you're going to be doing? Okay, so there'll be something that'll be put up to an option for behavioral health or counseling or emotional support that's specifically for students.
Okay.
I also want to mention, I'm looking at the IU's CAPS website. And CAP stands for the Counseling and Psychological Services. And they do provide limited services via phone and video. So that's something that you might want to contact them to schedule 30-minute virtual sessions. And I know that CAP's policy has always been that the first 2 sessions of counseling is free. There's a fee after the first 2 sessions, but the first 2 sessions are free. Once the coronavirus crisis ends, the Center for Human Growth is available for counseling at IU for those of you who are IU students, Center for Human Growth, but unfortunately that's not available at the moment.
One other thing I wanted to mention is some employers have systems in place so that if you work for them, that you can get free counseling. I know like the hospital does. My husband works at Boston Scientific. I know Cook has such a thing, but I'm sure there's other organizations that it's called EAPs, or Employee Assistant Programs. And usually they also have that you can see their therapist so many times for free before you get charged. So if you work for, you might look into your work situation to see if that's an option for you too.
And Chris, you may have touched on this, but again, if someone, there's a question here, how do I help persuade someone to get themselves tested if they are convinced it's just allergies? And if I do convince them, can they get tested locally now?
So that's a really good question. Unfortunately, well, first of all, fortunately, we do have quite a few tests in the area, but unfortunately, we are only testing right now in Monroe County if you are at the hospital, you're being admitted to the hospital because they want to know whether you have it or not, know how to isolate you, or if they're a healthcare worker, because if you are a healthcare worker and you might have symptoms, we want to know whether you have coronavirus because we don't want you spreading it. So unfortunately, there's no guarantee that if your symptoms are not really bad, you probably will not be tested at this point.
Okay. But it's still a good idea to, I mean, if you've got some symptoms that you're really concerned about and you think you've got a health situation, it's still good to contact a professional health person, right?
Definitely. And I would say if you are concerned that you may have coronavirus symptoms, I would first call the virtual visit or get the app on your phone for IU Health virtual visits, because then you can be screened free. And everybody that I know who's done it so far, they call in and they get put on a wait. And so far, it's only been like a 5-minute wait before they're seen. Whereas we all know that if you go to a doctor's office, you can be exposed to other things that you didn't walk in with. And right now, you definitely don't want to do that. And you are not going to be seen in 5 minutes. So I would really highly recommend using the virtual visit app through IU Health right now. Okay,
that's good. One last question. Some folks are asking whether the stimulus checks are going to be coming in the form of checks or electronically deposited. And previous stimulus checks like this have come both, either check or electronically. And there's talks right now that Venmo might be involved this time as well. Folks, they're just making this stuff up as they go. So this is an evolving story on how they're going to get these stimulus checks out. So we don't know for sure, but we can expect those sometime in the next 2 or 3 weeks. We'll know a lot more in the next couple weeks. So we're going to wrap it up now with some information. I'm going to ask Elin to bring up some information on the screen. We would really like to know more from you, what you're dealing with, and there's a survey that is going to help us to know how you're getting along and how we might be able to help you. And so if you could, go ahead and take this survey. It doesn't take too long. And if you can go ahead and write that down, copy and paste it. That's where the survey's at. And that'll be something that'll help us help you during this difficult, unprecedented time. We've never dealt with anything like this before, but we want to help. And BISM is an organization that really has the goal of coming alongside folks who are far from home and need a community of friends to help in a lot of different areas. There is the fellowship aspect of it. It's good to have friends to connect with and to share life with and to have fun with and to learn with and to grow with. And that's what BISM is all about. We do a lot of fun things when we are able to gather in person, cookouts and parties, and there's always food, and it's really a great time. In the meantime, since we can't get together and do those types of things, these types of online, if you enjoyed this tonight, you're going to love Sunday morning, because on Sunday mornings, we have something called coffee hour. And it's an online, at this point, it's an online gathering similar to this, but there's going to be teaching, there'll be interaction. We actually are able to break up into tables on the Zoom format and break up into groups and have discussions, and then we come back together and talk about some of the things that we've learned. And we're just starting a new series this Sunday, and we're going to look at the book of Philippians, which is a book that deals with a lot of heartache and a lot of issues that the early church was dealing with and how they responded. And it's going to be really timely. I'm very much looking forward to that this Sunday. It's at 11 o'clock, and you've got a link there for that. It's a similar format to this. And so we actually last week had people joining us from all over the world. We had someone calling in from China that was there at midnight, and they felt it was such a good thing that they were going to stay up till midnight to join us. We had people across the U.S. joining us as well. And so really a great opportunity to grow friendships and fellowship and learn. And so we invite you to that. And we already showed the information about CAPS. Please, if you are needing some counseling, if you're just having some anxiety issues or some depression or some stress issues, that's a good place to connect. And if you just want somebody to talk to, that we are always available. The folks at BISM are always available to connect with you and to talk through things with you. So we would offer that as well. I'm going to go ahead and I'm going to close this in a quick prayer. I think that's always a good thing to do, to ask the Creator to give us wisdom and discernment as we navigate these very frightful times. And then I'm going to stick around, and if Joel and Chris are able to stick around for a few minutes, we might be able to take a few more questions. And so we'll hang around for a few more minutes at the end. But if you could, let's go ahead and we'll end in prayer. God, you're so good. And Lord, we thank you for this time. We just want to pray for every single one of these people that have joined us tonight. And Lord, we pray that the information was helpful. God, we pray that they would get their strength and courage from you. Lord, we know that you're not scared. You're not confused. You're not bewildered. You're not afraid of what's coming next. And you've got it all figured out, and you're in control. And so we trust you. And because of that, we have no fear. And so we just have a confidence that you're doing this for a reason. And we just ask that you would show us what those reasons are. And Lord, we have a pretty good idea that we're supposed to grow deeper in our relationships with our friends and our family. And that maybe we were a little too busy. So you canceled everything. And now we have more time to do things that possibly matter more than the activities we were involved in. And we do want to pray for those who are dealing with this virus right now. We pray that you provide them healing. And we pray for all the healthcare workers that are risking their lives to help them. And we pray protection for them. And again, we pray for wisdom and discernment, Lord, that we would know the truth and it would set us free. We pray these things in Jesus' name. Amen. Hey, thank you, folks. It's been a pleasure. And we'll stick around if you have additional questions. See if there's been some more on the chat screen.
Thanks. Thank you. Appreciate it.
And someone's asking, is there a way to access the recording of the webinar? I'll let Elin answer that one.
Yeah, it's recorded, and I will put it up on the BISM website.
Okay. Thank you, Elin. Elin, really appreciate Elin. He's the one that put this together, and he's been doing everything behind the scenes, which is where he often likes to operate. And he is the brains and the energy behind BISM. And so really want to thank Elin for all his efforts to pull this together. This was his idea and his work. So we just all thank you. And I see all the thank yous are coming in from the chat screen. Thank you very much, Elin. Here's one for Joel. How to cope with loneliness, especially during the pandemic.
All right. Okay. Loneliness. Yeah, that's a very real concern because, um, if you've been used to connecting with people a lot and all of a sudden you're kind of stuck at home, that's a very valid thing. So a couple of things, as I said, I try to find excuses to get involved in a video chat with someone. If there is, even in a work setting, if it's possible, I say, hey, why don't we do it over Zoom? Even for friends, and I know it might feel a little weird to be initiating sort of an invitation to a Zoom chat, but you could always start by saying the email. Here's a challenge to all of us: send an email to folks that you have not connected with lately, for a couple of months perhaps, and send email to 4 or 5 of these friends and just say, hey, how are you doing? Would you be willing to, chat with me over Zoom and just, no agenda, just want to catch up with you and see how things are doing. And you would be surprised at how delighted people would be to just kind of connect with you over Zoom. All right. So I think that's one of the amazing ways to keep up with each other. And the excuse you can always give is, well, I just want to see how you're doing and how you're coping in the midst of the coronavirus. And so it doesn't feel so weird to be contacting somebody if you can give a reason to say, I just want to find out how you're doing. But here's a little tip I want to share about people who experience loneliness or people who have social anxiety. Very often, people who are either lonely or experience social anxiety, they're always waiting for someone to approach them, to establish contact with them rather than approaching others. And they're worried that, well, nobody's approaching me, nobody wants to talk to me, and I'm sitting here all alone, just with nobody to talk to. But I would say if you just take the risk and instead of waiting for someone to reach out to you, you reach out to someone else first. Reach out to somebody and say, hey, how are you doing? Can I connect with you? That would go a long way towards overcoming loneliness and building more connections. So take the initiative. Don't wait for someone to reach out to you. Don't ask why nobody's reaching out to you. You reach out to others.
It's good. It's great. Any other questions on the chat bar there? Anybody else think of anything? Looks like we've answered a lot of the questions, which is really good. Here's one. If I filed a tax return for 2019 and emailed documents a week ago, am I still eligible for a stimulus check? FYI, I have a social security number. Yeah, that sounds like you've checked all the boxes that you should be eligible for that based on that information. Okay. This one's for Chris. I learned even younger people who are presented with mild symptoms of COVID-19 tend to have tissue damages of the lung, heart, and brain. If I happen to have mild symptoms of COVID-19 and resolved with the symptoms, should I be consulting with the doctors to have medical examination for any of the possible tissue damages mentioned above?
So that's probably a bit above my knowledge, to be quite honest. I think in general, though, we don't know enough about how this virus is going to affect us. And we're going to be learning a lot as we go and in the future. And so I think that if you feel like you had the symptoms of COVID, but you weren't seen by a doctor or they were so mild, it's definitely something that you need to let your physician know next time you have your well check. And everybody should be having well checks annually. But it's definitely something that I would share with the physician. But I'm sorry, I really don't know enough to say much on that. Good question, though.
Any other chat questions that people have? All right, I think we've answered most of the ones that are on there. So, Elin, did you have anything else that you'd like to add?
Yes, I think I'm ready to announce the lucky winner is Rajkumar Dhanaraju.
Yeah,
Ah,
Mother Bear's Pizza coming to you.
I'm the one.
it looks like Rajkumar is there, huh?
I just the last question that I don't know, like she tried to answer. That's my question.
Okay, that's good. That's good. Yeah.
Good
So-
timing.
So
So
you
I
can
guess it would be inappropriate if we all gathered at your apartment to share your pizza with you.
I need to seriously clean my apartment. It'll take a week.
Okay.